Do you want to get pregnant with twins or triplets? If yes is your answer, watch this video to the end. I'll be giving us tips on how to get pregnant with twins and triplets, or what we call higher order pregnancies. My name is Dr. Nkiruka Bridget. I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes men's health on my channel. If you have not subscribed, please subscribe right now. Watch this video to the end, help share it so that those that need it will be able to view it. So let's go on. Planning to get pregnant with twins, triplets, quadruplets, or higher order pregnancies? Now you have to follow this video. Number one is genetics. Do you have a family history of twins? If you have a family history of twins, the probability that you have twins or triplet pregnancy is so high. Twins pregnancy runs in family, especially when it is from your maternal side. What I mean is that if your mother has twins, or your grandmother, your mother's mother has twins, you are likely going to have a twin. Or your mother's sister, I mean your aunt. So far there's family history of twins, especially from your maternal side, you are at risk of having twins. So work with it. You can have twins if you have a family history. Another one is that if that twins from your family side are fraternal, that is they are zygotic, they don't look alike, the probability that you have twins is high. If the twins are male and female, the probability that you have twins is high. It's always rare when it is with monozygotics. I mean twins of the same sex or twins that look like each other. So if you have a genetic history or family history of twinning, you have a probability of having twinning. And the second point is, if you live in the tropics, Africa, mostly Nigeria, you have a higher risk of having twins. If the location where you live is in the Yoruba land or some part of Igbo land, you are going to have twins because there is this genetic history that has been passed through one family to another. In fact, there's a place in Yoruba land that everybody in the family is a twin. So yes, I'm telling you the real fact. Everybody in the family in that place is twin. So if you find yourself in that place, or you are born in that place, you are likely going to have twins. Or you marry someone from that place as a man, you're likely going to have twins as your pregnancy. That's number two. Number three is with the use of drugs. There are some fertility drugs that predisposes one to having twins. One thing with fertility drug is that when taken, most times they form multiple follicles. The eggs released are multiples. And peradventure, the sperm fertilizes these 2 or 3 eggs released, you're likely going to have twins. What do I mean? Those that have been treated with clomiphene citrate, clomid, the drug you know, those treated with it, they are at risk of having twins because the drug goes on most times to cause release of multiple eggs. And when 2 eggs are released, matured, released, and they are fertilized by 2 different sperm, the person is likely going to have twins. So that's another reason. Another reason is those that are taking other drugs like letrozole. The risk factor with letrozole for twins are not as much as when it is with clomid. So someone on clomid fertility drug, someone on letrozole can have twin. Someone on follicle stimulating hormone for fertility can have twins. These are the drugs used to induce ovulation. And on the process of inducing ovulation, the person may develop multiple eggs and will have twins. So other drugs include gonadotropins, most times injectable. This drug contains the follicle stimulating hormone and the luteinizing hormone. They mimic the hormones from the body. The follicle stimulating hormone and the luteinizing hormone that is released by the brain. So they go on to increase follicle maturation, most times not 1, maybe 2 or 3. And when these follicles are matured, they are released, and peradventure they are fertilized by 2 different sperms, go on to have twins. Now another is with the use of assisted reproductive technology. Assisted reproductive technology gives you the opportunity to have 2 or more embryo implanted. What happens is that, for example, in vitro fertilization, the woman that is about to undergo this procedure is prepared. Most times she goes on to have ovulation induction, and she's monitored. Multiple eggs are picked, 1, 2, 3, 4, and they are fertilized outside. And when they are fertilized outside, those 4 are carried and implanted in her womb, that's in her endometrium. And most times they go on to mature, 4 of them, or 3 or 2, and the person goes on to have twin gestation or triplet gestation. So in vitro fertilization is one of the ways to have multiple pregnancies if you so desire. Now the next is sporadic. It happens on its own. You just see a family that has never had a history of twin, and sporadically they have twin. So these are the methods to have twins if you so desire. If you have watched to this point and you have not subscribed, please subscribe for more tips on how to get pregnant, how to have twins, how to have the sexes you want, and every other help that concerns women and children and men. Thank you for following me. Share this video. See you next time for another enriching, beautiful video. My name is Dr. Nkiruka Bridget at OBGYN Talks with Dr. Adazion. I'm on Facebook at OBGYN Talks with Dr. Adazion. I'm on TikTok, Instagram with the same name. Subscribe to my YouTube page. See you next time. Love you.